Good evening, everyone. The open meeting law requires that I notify the public that this meeting is being recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made by Boston City TV, a part of the City of Boston Office of Cable Communications, and is being broadcast on Xfinity Channel 24, RCN Channel 13, and FiOS Channel 962. And now I hand it over to Jerry.
Thank you, and welcome to this January meeting of the Disability Commission Advisory Board, our first meeting of the year, and it's a jam-packed agenda. And now I will turn it back over to Jessica to assist with the introductions, please.
Wonderful. Do we want to start with Jerry Boyd?
Oh, sure. I'm Jerry Boyd. I'm the chair of the advisory board, and I live in West Rockford.
Wonderful. Next, we'll go to Carl Richardson.
Carl Richardson, advisory board member, Brighton.
Great. Can I have Elizabeth Dean Clower?
Hi, Elizabeth Dean. I'm the vice advisory, and I live.
You live in Back Bay, is that correct? You cut out a bit. Yes. Great. Thank you so much. Next, can I have Kyle?
Hi, Kyle Robidoux, board member, and I live in Lower Rockville.
Wonderful. Can I have Olivia, please?
My name's Olivia Richard. I live in Brighton, and I am the secretary for the board.
Wonderful. Can I have Paul?
I'm Paul Karen. I live in the West End, and I'm a board member. And I just want to say thank you, Jess. We're going to be missed for all you've done over the past few years.
Thank you so much. Next, can I have Wesley?
Hi there, Wesley Ireland here. I'm speaking through a sign language interpreter. I'm a board member, and I live in the North End. And Happy New Year, everybody.
Thank you so much. Yeah, what a good start to the new year it is today. Next, can I have Yardley?
Hello, everyone. Yardley Sanchez. I'm a board member and I'm a Dorchester resident.
Wonderful. Thank you, Yardley. And last but certainly not least, do I have Zari?
Hello, everyone. Zari Amir Hosseini. I'm from South Boston, board member, and Happy New Year.
Wonderful. Back to you, Jerry.
Great, and now we have a couple of months, October and December's meeting minutes to approve. I hope everybody's had a chance to look at them, and assuming everyone has, do I have a motion to approve the minutes?
I'll make a motion to approve.
Any
I
second?
second the motion.
Second.
Paul seconds the motion. Any discussion?
No.
All in favor?
Aye.
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 I believe the motion passes unanimously. Next, we have some administrative updates, and I believe the commissioner will be leading that discussion.
So I believe that actually, the administrative updates, we are waiting for a staff member from Intergovernmental Relations.
Oh, okay.
To discuss so I phrased it as administrative updates. Really what it means is we're bringing in someone from Intergovernmental Relations to discuss the most recent stimulus package, as well as kind of what Biden's proposing for in the next couple months. So they are going to speak with us soon. I'm hoping they hop on.
Sure, should we move on?
Jerry, can I say something?
Go ahead.
I wanted to let everyone know that we lost a member of the disability community very recently who was a fierce advocate for ASL and staff rights and just an overall good egg. Her name was Felicity Lingle, and she passed away in a nursing home.
Sorry to hear that.
Yeah, I was just, she was very involved with the city. The city council made a motion recently at one of their meetings to honor her, and I thought it would be nice to raise her up a little here, and
Could I recommend a moment of silence?
yes. Yeah.
Sure. Why don't we take a minute then?
Thank you.
Thanks.
Felicity was very young. I'm sorry for her loss.
Yeah.
Yeah, I know that she was close to you, Olivia. I am sorry for your loss. I don't know about the commissioner, but this is the first that I'm hearing of it. So
Yeah.
I know that she worked extensively with our office, and we really appreciated all of her advocacy over the years. And it's a great loss to the community.
Yeah, I didn't hear about it either. I'm surprised. But thank you for bringing it up, Olivia. Should we move on to the vaccine focus group then, Jessica?
We should not actually, because I see that Caitlin is on the call. So hey, Caitlin.
Hey, I'm sorry for
nope.
being a little late. My apologies.
No worries at all. It was closer to 5:30 than I gave you the impression of. So no worries. So I gave them a brief overview that you were just going to touch on past kind of what the stimulus plan had done, and then looking to the future as well.
Yeah, sure. So thank you guys so much for having me here tonight.
Caitlin, can you introduce yourself, please? This is
I'm
Jerry.
sorry?
I'm the chair of the advisory board. Can you just introduce yourself, please?
Oh, yes, I'm sorry. Can you all hear me? I'm hearing an echo. I don't know.
I just muted everybody with
okay,
the
great.
exception of sorry, can you mute yourself? I muted you accidentally, and so you then muted. There we go. Perfect. We should be good now.
Great.
Go for it.
Can everyone hear me okay? So thank you. So by way of introduction, my name is Caitlin Pasafero, and I am the Director of Intergovernmental Relations in the City of Boston. So at a very high level, my office oversees the city's relationships with all three levels of government. So the local level being the City Council, the state level, so we work with the legislature and also the executive branch with the Baker administration, and then the federal government. So we touch upon all three of those and work to advocate for city priorities at all three levels of government. As Jessica mentioned tonight, she asked me to come here just to give you guys, everyone, a broad overview of the Biden-Harris administration's COVID relief package. So just to give people context, the president, now I was going to say president-elect, but now he is officially the president. So the president rolled out last week a large spending package as a response to the COVID-19 virus and its immense economic implications. The package totals $1.9 trillion in stimulus spending. It includes funding for state and local aid, more generous unemployment benefits, and critical resources for mass vaccination. And just for context, the CARES Act, which I'm sure a lot of you heard about, that was actually passed in June. So for context, that was a $2 trillion bill in funding. And then the most recent relief package that was passed in December was about $900 trillion. So as I mentioned, what the president and vice president have proposed is $1.9 trillion. And so from a municipal perspective, we kind of bucket our priority areas into local aid, public health, direct assistance to individuals, housing, schools, economic stimulus, and childcare. And so I'm just going to briefly in those buckets kind of give you the highest level of what we're interested to see. So on the local aid piece, the local aid money is incredibly important to allow municipalities to do what we need to be able to do to support an equitable economic recovery. And so the most recent relief package that was passed in December had no aid for municipalities, and that was incredibly disappointing. So we were very relieved when the president when his bill is now recommending that there will be $350 billion in emergency funding for state, local, and territorial governments. So again, this money would be money that would flow directly to states and cities and will allow us to provide support to small businesses and vaccine and testing. So that's really critical. And it was a piece that in the stimulus bill in December, there was a lot of conflict over whether there should be local aid, and it ended up on the cutting room floor. So we're very fortunate that the president and vice president have taken a lead in this and included relief for local governments in their most recent proposal. From the public health perspective, there's $160 billion in funding for a national vaccination program, expanded testing, a public health jobs program, and other steps meant to fight the virus. Next would be direct assistance to individuals. So, there's been various iterations. So the first COVID relief bill in June provided up to $1,200 direct payments to individuals. The most recent provided $600. What the president and vice president are recommending is a $1,400 per person check to households, again, to acknowledge the immense economic pain that our families and individuals have been feeling, and to give them money for their most basic needs that also will be injected back into the economy and help us in our recovery. In terms of housing, something that the city has really advocated for, the president and vice president are recommending an extension of the federal eviction moratorium until September 30th of 2021. This is so critical. At a local level, we do have an eviction, at a state level, we do have an eviction moratorium, but that ended at the end of the year. And so it's incredibly important for our federal partners to have this extended protection at least through September 30th. And I think the hope is that by September 30th, things are back on track and people are back at work. But obviously we have confidence in the Biden-Harris administration that if we get to September and we feel it like we're at a place where people are still in a position that they need help with their housing, that eviction moratorium, continues as long as it needs to. In terms of schools, which obviously have been incredibly hard hit, they have proposed $170 billion. About $130 billion of that would go towards reopening and just ensuring that schools and teachers and kids are safe. It's certainly been a priority of the city of Boston to get as many kids back into schools. We've obviously prioritized those that are highest need, the kids that really need to be in a school setting in order to learn. So we do have, several hundred kids that are in school buildings now, but the general population are still learning from home. So I think some, additional federal stimulus money will allow our schools to open more safely. We have about, 124 Boston public schools across the district. So there's a lot of ground to cover with about 55,000 students. So, federal funding for the school district is pretty critical to being able to reopen in a safe way. Additionally, something that's great that we have fought for at the local level and was implemented in a phased approach at the state level. The recommendation from the new administration would be a federal minimum wage would rise to $15 an hour. And so again, I think that's something that the Commonwealth is getting to in a phased approach, but for that to be across the board would be a huge victory for workers' rights across the country. Childcare is another area where the city, we really prioritize. I think throughout this crisis, we've seen the impact that childcare has had, particularly on women. The women are leaving the workforce at a higher rate than men, and it's primarily due to having to homeschool and not having the ability to work from home. That's a luxury that many people do not have. And so a lot of women have had to leave the workforce because of a lack of affordable childcare. So the Biden-Harris administration in their proposal are recommending 14 weeks of paid sick and family medical leave for caregivers that are dealing with closed schools or care centers. So, this would be an opportunity for people that are frontline workers, or like I said, that can't actually physically go into work because they have to stay home with their children, to give them, that 14-week cushion of pay where they don't have to give up their job. And then lastly, just one I didn't mention in my opening remarks, it's something that we have worked on. Our Office of Food Access has worked tremendously with the state and the federal government, but is on nutrition and food access. So one thing that the Biden-Harris administration is planning to do is extending the 15% supplemental, the SNAP benefit increase through September 21, and also creating a $3 billion nutrition program for women, infants, and children through the WIC program. So that's a very high level overview. Like I said, a $1.9 trillion bill. The bill summary itself is 20 something pages. So as you can imagine, the actual document itself will be thousands of pages. But yeah, happy to, answer any questions that you all have, even if it's not related to federal. Like I said, my office does municipal, state, and federal. So I guess I'll just turn it over to question, Jessica. Is that okay?
Yes, sorry, I figured out that some of the feedback was actually because we have to mute ourselves, which I didn't think was a thing I could do from here. But it turns out I can. So yeah, we can open it up for questions, Caitlin.
Great.
Yeah, Caitlin, this is Jerry. I'm the chair of the advisory board again. I really appreciate your presentation, and I think it's extremely timely with the advent of the new administration and whatnot. How best can individuals, get involved and advocate? Because I know discussion around the bill is going to be happening, hopefully fairly soon. But how can we get involved?
Well, I think that's a great question. I'd say, direct advocacy to your representatives in Congress, I think, is always helpful. We are very fortunate that here in Massachusetts, our federal delegation, I think, I'll speak for my own personal, I feel like they really carry the mantle nationwide on prioritizing public health and economic recovery. But I always think that reaching out to the federal delegation to express, the specific needs, because to your point, it's a large bill. There will be things that won't get done, and so if there's items in there that are maybe not, I think a lot of times what can happen with these large bills is people get caught up in the big things, right? So there's the $1,400 stimulus checks that everyone knows about and everyone reads about, and it's all over the news. But there's a lot of transformational pieces that are all throughout the bill. So if that there's a particular, going through different advocacy groups, that there's a particular line that you're interested in, I think that, you shouldn't take for granted that that's been flagged for congressional leaders, that that's a priority for, certain constituencies. So I think that that's certainly helpful to do for them.
Where can we get, this is Jerry again, where can we get a good executive summary of the bill, or, so that we can dive down on some of those line items?
Yeah, so I'm happy to. I can, if it's okay through Jessica, I can share a document that provides a pretty good, like I said, it doesn't cover everything, but in terms of the bucket areas, it touches most of the big stuff. So I can share that and with Jessica and her send it out to everyone, if that's okay.
That's great. Thanks so much. Any other questions from members of the board?
I believe Commissioner's got a question.
Hi, Commissioner.
Hey, Caitlin, thank you so
Good to
much
see
for coming
you.
tonight. It's great to see you too. I miss you.
I know.
Caitlin's our neighbor on the 9th floor. So
I know,
We
miss
haven't
you.
seen each other for a while. That was a great presentation. We really appreciate it, and we know it's complex. One of the things that I've seen, that we've all seen during COVID, is we all have to depend on technology now so much. Is there anything that talks about the digital divide and trying to get more resources for digital connectivity, where we're all seeing the need for it now at this time?
Yes, there absolutely are technology pieces in there. I, off the top of my head, can't, if there's other questions I can pull up, or I can come back to it. I can look through the summary that I have. Off the top of my head, I don't know that what explicitly is included, but yeah, that I believe there are parts of the bill that does address that.
And is that something that can be addressed at the local level too, when cities get funding?
Yeah, I think so. And I know that there's a lot of, internal work at the city level in terms of the digital divide, just what we've seen, particularly with our students. I know that it crosses, it's not only students, but it's elderly, it's, obviously our low income residents as well. So I know that our Do It team, that's something that they, I believe, have or have a working group on to try and figure out, what things at the city level and also then the state level can be done to your point, to eliminate the digital divide, because obviously it's been such a critical component to everyone's, daily function over the last 10 months and will continue to be for several more months. So it's certainly absolutely something that's on the forefront, I think, of the, our administration's priority list.
Great, and I'll keep in touch on that, so thank you.
Yeah, thank you.
I know Olivia had a question.
Yeah, is there a plan for Biden to invoke the Defense Production Act to make more vaccine?
Yes.
And how is Boston sitting with our vaccine supply?
So I'll preface this by saying I can talk high level about this, but I'm not the content expert, at least on the city level on vaccines. But so to your first question, yes, the president has said that he plans to invoke that to ramp up the vaccination program. So I think he's unleashed, what was it? I want to say off the top of my head, first 100 days, he wants 100 million vaccines. I think that's
that's correct.
So I think that's something that the administration is planning on doing. In terms of your question about the vaccines at the municipal level, so the role of municipalities, the state owns the vaccine distribution. So they create the prioritization. So I don't know if you've seen, but if you go to mass.gov, right on their front page, you can click for information on vaccines where they list the tiers. So tier 1, tier 2, and they also within the tiers have prioritization, of who will be first, second, third, et cetera, before you move on to the next phase. So that is all created at the state level. And where municipalities step in is, I think, in providing sites, making sure that there's equitable access to sites. We certainly want to make sure that, at this point, the vaccines for the most part aren't available. It's not like the flu shot where you just, you go to your doctor's office, right? They're done. We've seen Gillette Stadium as a mass vaccination site. And so, municipalities' role, I think, is to support and encourage placement of vaccine locations, particularly in areas with a high population of people of color, and just to make sure that there's equitable access across the boards to vaccine. I think another place where there's leadership on the municipal level in vaccines is sort of doing this, and our Boston Public Health Commission is working on this, sort of a PR campaign. There's a lot of hesitation, this isn't specific to Boston, but there's a lot of hesitation from people on this vaccine. And, I think the trends that, we could perhaps see is that it's not being equitably, people are choosing because of longstanding systematic issues and kind of fear of the medical system, that there's groups of people that are very distrustful of the vaccine. And so how do we use leaders in the city to encourage people, everyone, to be to get the vaccine? I think that that's really where our role is. But in terms of the vaccine itself and the number that we get and how it's distributed, that's all done at the state level. Did that make sense? Is that?
Yes, thank you.
Okay.
I know Carl had a question.
Jerry, I lowered my hand back down because it got answered.
Oh, okay. I know Paul has a question.
Hey, Paul.
Yeah. Hi, how are you? We miss seeing you on the ninth floor.
Yeah, I know. That's all of us, all ninth floor people.
This is more of a rave or a comment than anything else. Just what an outstanding job the Walsh administration has done with the food access program at a local level. I know in the West End since the spring, with Father Joe White, Councilor Bach, State Rep Livingstone, it's been all hands on deck, and hundreds of people and families have been affected with the delivery of food and hot meals. And it just, it isn't always the thing you read about in the newspapers, but it's really been to this day in full effect and still going really strong.
Yep. And Paul, and Jessica and Commissioner, not to tell you what you should do, but I would highly recommend, Catalina Lopez Espina is our director of the Mayor's Office of Food Access. And to Paul's point, what she has done is nothing short of a miracle in these last 10 months. I mean, if the sites that she's pulled together at BPS, ensuring that kids, even when they're not in school, are getting lunch and they're getting breakfast, and because, a lot of our kids, school is not just reading in textbooks, it's also where they get their food. And a lot of kids, if they're not physically in the school building, they're not eating that day. And so I highly recommend anybody, or even using this forum, to hear Catalina and hear her talk about what they do and the resources that they provide and the work that they've done with the food banks throughout the city. It's incredible. So yeah, no, Paul, totally echoing your point. Absolutely.
I just want to make a small shout out to the gentleman who's smiling in his little cube, to Yardley Sanchez.
Yardley, yes.
Who specifically works for Catalina in the Office of Food Access.
Yardley,
Yeah, I can attest to urgent. No worries. But no, you're right. Definitely high praise to Catalina, who is the leader that we follow under in food access, and she has done amazing work, and I'm very happy to work under her and everything that we're doing to provide Boston residents with food access.
And I'm in a meeting with her twice a week. Some of the leaders in the Health and Human Services Cabinet, we meet twice a week just to talk about emerging issues and solve problems in real time. And Catalina has done incredible work. And so glad that Yardley's with her.
And with us.
Yes.
Yeah, definitely.
I apologize. Good to see you.
I personally know how the impact that food access has had, and access to those meals has been a lifeline to so many of us. So I really appreciate and echo all the good work that Yardley and your office has been doing. So thanks for bringing that up, Caitlin. Any other questions from members of the advisory board for Caitlin? Any questions from any members of the public? Hearing none or seeing none, I think we're all set. Caitlin, thank you.
And when I send along, the summary to be shared with you all, Jessica, please feel free to share my email. I'm always available, even if it's in 6 months from now and there's a bill at the State House that you're curious about or you have questions about. I'm always happy to be a resource. So thank you guys for all you do.
Thanks so much, Caitlin. Appreciate it.
Thank you.
Thank you.
Thank you so much, Caitlin.
Bye.
All right, next on the agenda, are we ready to move to the vaccine focus group presentation?
I believe we are.
Yes, and I believe we have our colleague Trinice with us. Trinice works at the Boston Public Health Commission. Correct me if I don't have your title right, but I believe you're the Director of Community Engagement for the Office of Health Equity. So I've been working with Trinice. She's doing incredible work during the pandemic. All of the Boston Public Health Commission is. So we talked about setting up a focus group for people with disabilities to figure out barriers to getting the vaccine and misinformation that we may be able to clear up. So I'd love to give the floor to Trinice and let her talk about what she's been working on.
Sure, but I should have. Hi, everybody. And my title did change. I am now the Director of the Office of Racial Equity and Community Engagement. That's a recent change and it happened fairly quickly. So what I should have done was practice how to share.
No worries. So Trinice, what you're going to want to do is at the bar at the bottom where you turn on and off your microphone and on and off your camera, all the way to the right. All the way to the right, it says Present Now.
Okay.
And then you just click that.
And then
it asks you, I think a window pops up and it asks you to share something, and you click on your computer screen and then hit OK.
Mm-hmm.
If that doesn't work, I believe you sent me the slides and I can find them.
I don't know that.
I I believe in our power to do this together.
We got this.
So, let me
We got
see.
this. Let's see. Did I send it to you?
I'm looking to see.
Okay.
If you didn't and you'd like to, I'm happy to share my screen, and thank you to everyone for your patience
Thank you for your
while we
patience.
figure this out.
Part of the digital divide, I believe, is our learning curve for some of these programs.
I know. I'm like, just when I think I have it figured out, I don't.
No worries.
Thank you.
Closer.
We're getting closer. Okay. I just hit send.
Great. So now we're just at the mercy of how quick email can go from one place to another.
Right, and while we're waiting, I can just give some background information. So we knew, right, a vaccine was going to be coming out shortly. And so as public health professionals, we wanted to get ahead of the curve and get an understanding of what people's perceptions and thinking and feelings would be about a vaccine. And so we launched a focus group initiative during the month of December. So for like the first 2 weeks of December, we facilitated focus groups as well as we launched a survey. And that was an effort again to gauge people's perspective or thoughts or ideas. Oh, you got them, yay, about a future vaccine. And so we conducted a total of 10 focus groups. One of them was internal with our homeless services staff who have, very unique schedules and shifts. And so we like to make sure that we're reaching our staff who aren't always, able to make it to, daytime meetings that may not be convenient for them. And then we also conducted meetings with residents who live in Boston Housing Authority sites, also some residents who are 1199 union members. And I want to point out that one of those focus groups was actually facilitated in Spanish. So we were really excited to do that. You can see from, I'm going to try to adjust. Yep, okay. So you can see from this slide that there were a total of 78 residents that participated in the focus group sessions, and 145 residents have taken the survey. And focus group participants, I want to just share in this space at the Boston Public Health Commission, we really, really take pride in our community engagement, our equitable community engagement practices. So we made sure that focus group participants were provided a $25 gift card to either Target or Stop and Shop to compensate them for their time and their expertise. And survey participants were offered the opportunity to enter for a chance to win one of those gift cards. So now I'll share a summary, and that's what you're looking at on this slide of the 2 engagement activities. And the questions that we asked were similar in both the focus group sessions as well as the survey. And the questions were, how many of you plan to take the vaccine? How many of you will not? And how many of you are unsure? If you will take the vaccine, what helped you to make your decision? If you will not take, or if you are unsure, what factors contribute to your decision? What information do you or do you think the general public wants to know when a new vaccine is available here in Boston? And what should public health or medical professionals do to prepare the community for a COVID vaccine, especially for those that are unsure or hesitant? And essentially, how can we build trust? What is the most common and trusted information source for you to hear and learn about COVID vaccine? Where will you feel most comfortable getting the vaccine? And should the vaccine be free or at a cost? So what you're seeing here on this slide on the left-hand side is that the majority of focus group participants identified as Black and stated that they will not take or they are unsure. And the majority of the survey participants identified as white and stated that they will take. And what you will see from both the focus group and survey participants, we have representation from Dorchester, all zip codes within Dorchester, Mattapan, as well as Charlestown. To the right of this slide are cumulative responses to why you will take and why you will not take. And the key themes of folk who said they will take, these are what surfaced. So fear of getting COVID-19, they're a caregiver to a young child or an older adult, they wish to return to a sense of normalcy, and they feel as though they have a personal responsibility to community. Those folk that said they will not take or they're unsure, common themes were medical mistrust or a history of medical experimentation. They have an underlying health condition, so they're concerned that the vaccine will impact that. Had a concern that the vaccine came upon us too quickly. It was developed fairly fast, and a lack of long-term evidence that the vaccine will be effective. Next slide, please. Thank you. And what you're seeing here are cumulative responses, to what information do you or the general public want to know when a vaccine is available here in Boston. And I'm not going to read all of these, but some of the common ones were, what were the results of the vaccine research trials, and what was the race, ethnicity of participants? How will the vaccine be made available and accessible to different populations? And again, as I shared earlier, like what are the risks associated with the vaccine in terms of who has allergies or maybe some underlying medical conditions. To the left of this, to the right, of this slide, we asked what is some trusted source of information, and overwhelmingly folks said a healthcare provider they would trust the most. And Dr. Fauci, his name popped up, I think, in every survey and every focus group that we did. So people are really, really trusting and believing in him. And reputable sources of information included NPR, CNN, mass.gov, and also people are tuning in to the mayor and the governor's press conferences. And then the next question is, what can public health or medical professionals do to gain trust? And folk would like to see translated vaccine research trial data and for that to be put in plain language. For medical and public health professionals to acknowledge historical medical mistrust, to establish a 24-hour vaccine hotline, and to report out the percentage of people vaccinated, report side effects, provide clear info on what the vaccine does and does not do, and to dispel myths about the vaccines. So again, as I shared with you, our timeline was pretty short. We had to move fairly quickly, and we launched this in December. And again, these focus groups took place over a 2-week period, and we had to actually stop and pause and not schedule anymore, so we could summarize this data and to get it to a place where we could actually develop a communications plan that I think was shared or referenced to earlier. So we'll continue to do these focus groups because, again, they're extremely popular and people really, really want to share their concerns as well as ask, a lot of questions. And again, it's all great because it helps to inform how we communicate with people and how we address their concerns with our planning. So I'll pause because I've said a lot. And again, this is just a summary. And so we are working behind the scenes to develop a more robust report of the data. It's always fun collecting the data and being in conversation with people, but the real work happens behind the scene when you have to start to summarize it and make sense of it all. So that's going to take a little bit more time, but we're a lot closer than we were. So again, I'll pause and answer any questions if there are any.
Can I just add one
Thank
note,
you.
Denise?
There we go.
Oh, sorry. I
Thank
just
you
wanted
very
to,
much for your presentation. This is Jerry.
Hi, Jerry.
Hi, I just have one question to start us off.
Jerry, before we go into questions, Commissioner just wanted to add one quick thing.
Oh, I'm sorry, Commissioner, go right ahead.
that's okay. Trinice, I believe we put a date on the books for our focus group. And I believe
You most did. Yeah, it's scheduled to take place next week, and I am just not sure of the date, but it's definitely scheduled to take place next week. I have it on my calendar. It's either next week Wednesday or Thursday. I could be absolutely wrong. I don't want to give you the wrong date, but there is a date scheduled for next week.
Yes, it's scheduled for next week. I will get the exact day and time. But I wanted to let people on the board know if you're interested, there's a link, you can sign up. And we'd love to have your feedback. And also, we'd love to have you spread the word.
Yes, thank you.
Sure. I guess that would be around my question. So this focus group will be specific for people with disabilities and all types of disabilities, yes?
Yes.
And where will the link be to sign up?
I think Commissioner, you have access to that link?
Yes, Trinice sent me the link, so we will get it out. Jessica, I don't know if you can put it in the chat.
I can. I have that magic ability. I will put the link in the chat right now.
And we're looking for 15 to 18 people. So if you can, if you're interested, sign up soon because we'll close it off after we get to that amount of people.
Sure.
Yes, thank you.
Sure. Do we
So I
have,
have a question about
yeah,
the
do we have,
focus group.
okay, go ahead, Zari.
I guess my question is the focus group really concentrating on certain communities, or is it an overall just disability community as a whole from different areas? So I know that your research focused on Dorchester and I forgot the other two areas, but I just want to make sure that if we find someone who's interested, but they're not from those areas, that they can still participate.
Yeah, absolutely. So what we did is we sent out an invitation citywide through the Boston Public Health Commission communication channels, as well as through our partners. The dates that were available, the dates and times that were available for focus groups, and whoever wanted to register and sign up had the opportunity to do so. And so they were hosted on a Zoom platform that the BPHC sponsored and supported. It's just a coincidence that the majority of the participants represented Dorchester, Mattapan, and Charlestown, but they were open to anyone who wanted to participate.
And Trinice, just one follow-up. I work at Mass General and I work with patients with disabilities. And one of the things that we are looking at is once they start deploying the vaccines, to make sure that we can make it as accessible as possible to people with disabilities, especially those who may not be able to travel to the hospital or other areas like CVS. So we're looking at mobile vaccine deployment as well as mobile testing. So one of the things that I'm hoping if you could, or I could maybe work with you on is kind of when you do these surveys to actually ask or kind of get a sense of whether people can actually access these sites once the vaccine is being deployed. And if not, I would love to get a hold of some kind of data or some information about what would be most helpful to get those vaccines to them.
No, that's a great point. Thank you so much. Sorry, we actually had a conversation during one of our leadership teams today, because we're public health professionals and we can't help ourselves but to promote the importance and the value of folk getting vaccinated. That's what we do through public health. And so we are now in this stage of where we're promoting our frontline workers to get vaccinated to protect themselves and their loved ones, as well as the people that we serve. And so one of our sites is at Tufts. And so we had a conversation today about access, right? And so it's one thing to, provide staff with accommodations to leave, and perhaps you can leave your shift for a few hours to go get vaccinated. But then we have to think about, what about transportation, right? Transportation is limited. You can't necessarily drive down to Tufts, right? So all of these things that we do have to take into consideration. So I've made note of that in my notebook that's right here next to me to bring that back, because you're absolutely right. And thinking about, folk, it may not be, the hesitancy factor, the fear or the concern. It might just be, I just can't get to it. And so how can it get to me? So thank you so much for bringing that up.
And I can add, Zari, that we're
That's
looking.
an outstanding point, Zari. Thank you again for.
Sorry,
for bringing
Jerry,
that up.
I wanted to add, to let Zari know that we're also speaking about that in the Health and Human Services Cabinet, because we know it was an issue for testing, and we never quite figured it out. So to go into people's homes is something that is being discussed. That can be very expensive and also labor intensive for staff. So we don't have a plan for it yet, but we definitely are discussing it, because we know that people with disabilities and older people, it's going to be tough for them to wait in lines. It's going to be tough for them to get places. So we're looking at some examples from other cities and just talking about it internally.
So Commissioner, just one thing before we go, before I let this go. One thing that I've learned is that Fallon was able to do some testing at home, especially for patients with autism. Some of those patients really have a very difficult time with the environment and just getting out of the house, never mind coming out twice to get vaccinated. So, and I know that there's a 15-minute wait after the vaccination. So I brought all of that up. What I need from our team, all of you, is kind of a support when it comes time to deployment, to say that there are, in fact, people who are unable to travel. And in fact, we need to think a little bit outside of the box to see how we can vaccinate these folks with that 15-minute wait, and to keep the vaccine safe so that it's okay to do it outside of a hospital environment.
Well, I can commit to you that we will keep that issue raised as a priority and keep talking about it internally, and I'm sure the Boston Public Health Commission will be doing the same.
Yeah, thank you.
But that's one of the reasons why we hope that you'll attend the focus group to bring these issues up.
Definitely.
I saw that Wesley had a question, but then he unraised his hand, so I don't know if he still does.
Yes, I do have a question.
Great.
So first of all, thank you so much for your presentation, Trinice. I really appreciate it. My question is, it seems like it's already been answered in some ways already. So my question is twofold. My understanding is you're collecting data and surveying different results related to the focus group. So I'm wondering what the purpose is. What will you do with the results, and how will you give those results to people? I'm also noticing that there's a small number of people in these focus groups. So of course, we can't solve all these issues with such a small group. So how do you face that? What's your plans with that?
Yeah, so the timeline was short because again, we knew a vaccine was upon us fairly quickly. And so we had a 2-week period to get the focus groups done. And that's why you see the number of focus group participants, 78 small. And we tried to mitigate that by also administering the survey and trying to, accommodate folk to participate in another way and by using a multi-pronged approach. So the timeline was the timeline and there really wasn't much we could do about it. However, we are committed to extending the initiative and offering opportunities such as the one that we have scheduled to support the engagement of folk with disabilities or unique needs. That's scheduled next week, so we can extend throughout January or February if we need to. One of the first things that we did as a result of the data collected from the focus groups and the survey was developed in two FAQs. One was for staff, because just because we're public health professionals and we're supposed to have all of the the background and the medical background and the information, we too have questions and maybe some concerns, and we're residents of Boston and we should be treated as such. So the fact sheets were developed for staff, and we also created one in partnership with City Hall for residents. And I believe that is being translated in multiple languages, perhaps as we speak, and not quite ready for prime time, but it will be ready soon, I think. And then also my staff, who is amazing, Janet Sanchez, I'm only as good as my team. And she was the one who was summarizing the data from the survey as well as the focus group. So we too created what we refer to as we asked, you said, we did. And so that's a report document that we are going to give back to participants first. Just because we owe them that much. So they'll see it first, and then we'll make that data readily available to everyone else by way of posting it on our website and distributing it through our partners.
And then just to add a little more information to that, Wes.
Thank you.
Also, the data and the information that we collect, we'll use for messaging to let people know that the vaccine is safe, and to make sure that we get the right facts out if people have misinformation. So it really will help us with outreach. And it will also help us solve problems like the issue that Zari mentioned about people not being able to wait in line. If we get those kinds of, if we get that feedback in focus groups, then we can solve each problem that we know is a barrier.
Yes, thank you, Commissioner.
Great.
Thank you so much. I appreciate it.
Sorry about that. I know Elizabeth had a question.
Yes, thank you. To my great regret, I had to miss this part of your presentation because I had two concurrent important meetings. But I did hear Zari's question and also the commissioner's follow up about looking at people who can't wait in line. And I would just like to reemphasize that that for people with, say, on the autism spectrum, as she had identified, or certain special needs, that it not only that there are people with certain disabilities who would find it difficult not to touch other people who are waiting in line, or who might get very overtly, upset by the situation. And given that, although the people who in line who are getting the vaccine might be, some people wholeheartedly are happy to be getting it, other people might have their own reservations. So I think for the well-being, particularly of people with certain disabilities, but even for the experience for the group setting, it really would be important to have some contingency for at least a subset of people in a way that could be prioritized.
I'll respond to that briefly. Another thing that could be a possibility is I think that everyone right now is focusing on the mass vaccination sites because there's a lot of talk of setting those up. like at Fenway Park and other areas throughout the state. But the vaccine's also going to be available to primary care providers. So if people with disabilities, particularly autism, have a care provider that they trust, that will be, I mean, everybody doesn't have to go to a mass vaccination site. People will also be able to go to their providers. So, I mean, there will be multiple options, and we will keep looking at others. But I don't want people to think that it's only going to be available in a big, crowded area where people have to wait in line.
Thank you, Commissioner, for that. But I know one of the concerns is when, will some of these, primary care physicians, have access to it? Like I go to a larger practice here in Greater Boston, and they don't, they only just updated their website just in the last couple of days, saying they have some available for those in phase 1. So I know there may be access issues throughout the process. So whatever we can do to help mitigate that will be greatly appreciated, I'm sure. So do we have any other questions from the members of the advisory board? Oh, Olivia has a question or a comment.
Yeah, one of the things that I hear in my circle of folks with particularly food allergies and, anaphylaxis allergies is that they're concerned about the rate of reaction, and that, either how the vaccine was prepared or, an ingredient or something will trigger their anaphylaxis. Now, I know statistically the rate of reaction is extremely low, but the reactions have been getting a lot of press. How do we fight that?
Trinice, is that something that you could comment on?
I mean, well, that's a tough one, right? As I shared in the data that was a concern. People with underlying condition as well as allergies have concern about there being reaction, and then folk wanting the government per se or the city to report on what those reactions are or look and feel like. So I'm not certain that, the science can predict, if what's in either of the vaccines will cause, a reaction. And I am confident that it's probably the right thing to report out if and when something does happen, right? As much as we probably don't want to share the negative, it's as we know, folk are concerned and they have fear, and I think that's what's going to help build trust, is if we're as transparent as we possibly can be. So Olivia, I'm not certain if I answered your question, but anything is possible. We can't guarantee how folk are going to react or respond to the vaccine. You can't predict that, right? We wish we could, but we can't, because everyone is different. That's what makes us special, because we're different, right? And so, we just have to go with it and hope for the best. But again, as public health professionals and medical professionals, we have to commit to being transparent when things don't go quite as planned or when something happens, and make adjustments along the way, right? And so I can imagine, I don't work for Pfizer or Moderna, and I don't know the science, right? I can only hope that as we're learning and we're navigating and going through this process, that there can be adjustments made to the vaccine. Right, again, I'm not the scientist, but there can be adjustments made if there's enough data that shows, hey, this happens when this person takes it because of X, Y, and Z. And so some adjustments can be made when necessary. So hopefully okay.
Yeah, I'm concerned about the statistics. The statistics themselves are really low, but what comes across NPR or the press is this person and that person, and they're having these grave things happen, and it's like, well, it's the same statistic that someone who had the measles and mumps vaccine would. There's going to be a subset that's going to react. How do we get that across?
That's great. Thank you for bringing that up, because we do into this too. Is we're in space. It's with City Hall and public health professionals, and really trying to come up with a communication plan. It is really, really important for us to get ahead of some of the other sources of information as public health and medical professionals, and really become that trusted source of information, so we can help to mitigate either the myths or how the press can make something look perhaps bigger or larger than it is. So I'm really glad that the Boston Public Health Commission gets to work alongside our colleagues at City Hall to develop a communication plan that, again, puts us as the center perhaps, or the leaders, and a trusted source of information to help with exactly what you just presented in this space.
A few comments about that from my perspective, Olivia. First of all, I think Trinice is right that communication is key. So anybody who knows they have an allergy really needs to work with their primary care provider on it. And then the second piece is that somebody mentioned earlier that there's a waiting period after you get the vaccine. I would emphasize that anybody with a disability or anybody with an underlying medical condition, definitely make sure they stay for that waiting period. We don't want people leaving and then having a reaction when they're out of the care of the medical professionals. And then the third thing I've read, and this is just my personal perspective that I've read, is that the government and the national CDC, they are keeping tabs on these reactions, and I believe some batches were even pulled if they caused some reactions in people. So I think that we really do need to trust the science, stay in communication with our own medical professionals, and make our own personal decisions. We're certainly encouraging people to get the vaccine, but everybody knows their own health better than anyone else. So if it's something that you know personally may affect you, just be sure you have those conversations with your own medical professional.
I know Elizabeth had a question. Elizabeth?
Yes, thank you. I think actually the discussion with Olivia partially answered it, but Jerry, just like I think what you were seeking to know is if there are ways we could help get out the word. I know that one of the other issues that comes up with communication, and I don't know even in our own newsletter if it could be addressed in this way, that I think sometimes because using analogies about other things like lightning, when someone is hit by lightning, or with things like a plane, when you hear that the entire crew and passengers, everyone died or many people died, that having some sense of relative risk, like had been mentioned a few minutes ago about the risks that, there's a small risk that occurs with any vaccines, or what is the, particularly with the more contagious strain, what are having some sense of risk and benefit in the scheme of what might your reality be, particularly if someone has an underlying disability, if you were to get COVID and have bad complications versus the vaccine. And I even personally understand the dilemma people are facing, even if they're have a strong belief in science and clinical trials, because naturally when using healthy volunteers, they don't have specific information on how it will affect certain subgroups. But I think that it's important to try to have some perspective, if you will. That the one analogy I'd give is that because there was such an effective campaign years ago for breast cancer awareness, that many women were from the general public were under the impression that breast cancer was more of an issue for them than a heart attack, for instance, for postmenopausal women. And I think that without getting into too much detail with people, but to try to state things simply, but maybe with a couple of references so that helps make people make a decision as well, or potentially might help. Although I realize, as we've learned in other categories such as politics, that some of what drives people is more at the emotional level than whatever facts or science is available. So, but it's all, the very fact that it's here, that a vaccine, that we're at the point we are at this time in 21 is at least very hopeful.
Well, thanks, Elizabeth. Do we have any other questions from the advisory board? You have another question, Elizabeth?
No, I didn't. But thank you for.
Okay.
Yeah. I could get the slides.
Your hand is still raised, so it's okay.
No, excuse me. I was just saying the slides. I'll make those. I'll do that offline afterwards of how to, not the slides, but the talking points or whatever. Thank you.
Okay. Any questions from any members of the public? Hearing none. Thank you, Trinice.
You're welcome. Thank you so much for inviting me. It was a pleasure. If any questions come up later, feel free to reach out to me. And don't forget, I think Jessica dropped the link to the focus group that's scheduled next week. So register or help promote so we can get your voices heard. Thank you, everybody.
Okay, thanks. We look forward.
Thank you, Trinice.
You're welcome. Take care.
Okay, and next on the agenda is my report, and I'll just make it very, very brief. I was working today, and I had the inauguration activities, on in the background, and I was quite moved, despite, all the rancor and despite everything that happened on the 6th, the insurrection, that every 4 years, this country, still has a transition of power, a largely peaceful transition of power. It's just very, very moving, and today's, speeches and activities was all very moving, and I hope the country and the city and the state, I hope we can do it all, just a collective exhale, and I hope that really, that this allows us to move forward and allows us to, like we said earlier, with the relief package that people begin to trust the science and trust the news and everything. So I'm very much look forward to 2021. I think things are on the upswing. So, and with that, we'll move on to the commissioner's report.
Thank you, Jerry. So I guess Jerry made a good transition to my report, because one thing that I will talk about is transitions. So we all have heard by now that Mayor Walsh has been nominated as the Labor Secretary. So we'll have some transitions going on in our local government. But I just want to assure everybody that our work will continue. We are very focused on COVID response. We're working with the Office of Food Access, as you heard earlier. We work with all the other Health and Human Services departments, Age Strong. We work with the Mayor's Office of Immigrant Advancement, and we continue to do all the work we can to support residents with disabilities. One of the things that we're doing, like we mentioned, is the focus group next week. I really hope that some of you will participate, and please spread the word. And on that note, I just want to ask people to continue staying safe, wearing your masks, get tested, and do all the things that we need to do until we get the vaccine. So some other things that are going on in my office, we can talk about. There's a lot going on in the Parks Department right now. My architectural access staff is looped in on the master planning. There are projects coming up on Copley Square Park, Malcolm X Park, and Ringer Park in Alston. There's a public meeting next Tuesday, January 26th at 6 p.m. for the Ringer Park project. So anyone who'd like to attend, we can send you information on that. And another event that I wanted to mention is tomorrow night, there is a town hall on the vaccine as it relates to home care workers. If you haven't heard, PCAs and home health care workers have been moved to Tier 1, and they're supposed to be getting vaccinated starting the first week of February. So there's a teletown hall tomorrow night that the state is putting on about the vaccine and healthcare workers. And I believe the link is mass.gov/townhall, but we can confirm that. I would suggest everybody tune in if you're available. So other things that we're working on, we're working with the Boston Public Schools on financial empowerment. We're going to start a program with transition age students to help them learn the basics of financial empowerment, and that will hopefully kick off sometime in the spring. Another thing that we're working with the Boston Public Schools on to follow up on Wesley's question about Horace Mann is just keeping in touch with them about the new building and the swing space for when the school is in transition between buildings. We did have a meeting with BPS staff, and they assured us that they are going to be dedicating a building to the Horace Mann. It won't be integrated into another building, but we can follow up with you more offline. And BPS did commit to staying in touch with us throughout the process. A few other older items are the Captioning Ordinance, which is still, we're still working on that, and also the City Hall Plaza Agreement we're still working on. And even though there is a transition in leadership at the city level, I can assure you that these projects won't get dropped. They may be delayed a little bit, but we will still be working on them. I think that's all I have, except that I did want to mention that with the new year, it is time for elections of officers. So we can put that on the agenda for next month. But if anyone has any comments on positions they'd like to hold, you can let us know. And I can open the floor for discussion on that. Jerry, I know you had mentioned it, if you want to comment on it.
Yeah, I had mentioned it at our last meeting before our break and everything. I just think it's, I kind of like the city council model where their president keeps the term for 2 years. I've been chair for 2 years now, and it's quite the honor, and I really enjoy my work, as chair. But I'd like to see someone else have the opportunity and have opportunities in leadership for the advisory board and have their ideas kind of drive the ship. So I encourage anyone. You don't have to let us know right now, today, but let the commissioner's office know, and hopefully we can have elections next month. I know Carl also has a comment.
Hi, this is Carl. Typically, I think in the past we have formed a nominating committee who recommends the slate of officers, and then if anybody wants to run against anybody on the proposed slate, they can do that. So I think typically, Jerry, you appoint a nominating committee, and then the nominating committee recommends the officers, but the people who want to run can let the nominating committee know of their interest.
I'm pretty sure that didn't happen last time, but
maybe not, but it has happened several years ago.
Well,
probably didn't happen last time, but it has happened in the past.
I'd like the direction of the commissioner's office on how we should proceed then, I guess.
But I think it's in our bylaws.
Okay.
I don't know, Carl, if you're thinking of another board, but I don't think we've had a nominating committee. I think we've opened the floor and asked people to speak up if they're interested. And last time we were really lucky because only 4 board members were interested, and they took a vote, and all the people who ran for office, quote unquote, they were supported, and the majority voted. So I think that we can just open up the floor if that works for everybody. And people can just shout out if they're interested. And we don't have to do it tonight, but I would say we'll put it on the agenda for next month to actually call for a vote and elect officers, if that works for the board.
Yeah, or again, no pressure, but I'd like to see us. I'd like to see us have elections in this year, new year. So
I do want to note just one administrative thing. So there are 4, just so that everybody kind of understands how the positions work. There are 4 positions that are written into our bylaws. So there is chair, vice chair, secretary, and treasurer. While the treasurer is an equal and important member of the executive committee, I just want to be clear, the treasurer does not control any money. There is no money related to the advisory board. It is in name only that you are a treasurer. But it is in our bylaws that we have to elect someone who is a treasurer as well as a secretary, and chair and vice chair. So the chair and vice chair work in partnership to run the meetings. Ideally, they would also help. I know that, Jerry, this hasn't been a thing that our board has done recently, but in past roles, they've also worked to craft the agenda. They have also occasionally handled the very annoying monthly emails that you get from me. So that will be passed on to someone else in our office, but it could be handled by the chair and vice chair. Secretary has often been the person who is in charge of writing up the minutes. Which
Olivia has done a great job of in the past.
Which Olivia has done a great job of in the past. And this secretary can write the minutes with a variety of support from our office. If someone is interested in being secretary but is nervous about taking notes live, I will offer this bit of support that the board meetings are recorded. And so you could write the board meetings like I do, in which you are listening to them after the fact, so that you don't miss anything and do it later. So I do want to put those 4 pieces of this information out in advance, so that people can spend some time thinking about if there are roles that they're particularly interested in. Feel free also, I'm going to volunteer all the executive board now to reach out to any of the executive board members if you are curious about what it's like to be in that role. Or reach out to our office, and Commissioner can support you in answering any questions related to our board meetings or related to kind of the roles and responsibilities of those positions.
Yes, and I also want to emphasize, the folks in their current roles do an excellent job. So, I'm not opening this up to because I want to see a wholesale change or anything like that either. I just want anybody who wants an opportunity to be part of the leadership of this group to feel free, to feel that they can participate. So, and I think it's a good practice.
Yeah, and Jerry, I want to thank you. You've done an outstanding job as chair, and Elizabeth, Olivia, and Ducia. And please, if you're interested in running again, feel free to do that. But I agree with Jerry. Sometimes it's good to get a new perspective. And the executive committee themselves, the 4 positions, they have met infrequently, but we can always, take on initiatives with just the executive committee to kind of steer the board in certain directions. So I'll put it on the agenda for next month to call for a vote. So everybody can think about it, and you can email us if you're interested, or if you want to nominate someone else, you could reach out to them and see if they'd be interested. So I look forward to seeing what happens next month. And also a few other things just to conclude my report. We do have a staff person on the line who is someone we worked with closely for a long, long time. And I don't want to put her on the spot, but I want to see Mimi, if you would just say a sentence or two about your work. And we're going to have more information next month on her program. But if you would like to just talk a little bit about the tax days.
Sure, I can do that. Hi, everybody. I was actually going to ask you a question, Commissioner. Can I ask you a question first?
Sure, absolutely.
About your report?
Yeah, absolutely.
I wanted to know, I know that people probably have seen that the BPDA passed amendments to Article 80, which is the large project review. And part of that included the disability checklist. And I was wondering, I wasn't sure whether or not that was new or that they just, it became, as it was promulgated, if it was just something that had been in place, but they just, put it in affirmatively in Article 80. Had they been doing it, and is it new or is it not? And will it have significant impact for the community?
Yes, thank you so much for asking that question, Mimi. I should have had this in my report. But the Article 80 process is what developments go through before they're approved to move forward. So the accessibility checklist is a tool that my office developed in 2015. It was the first ask I had of Mayor Walsh when he became mayor. I said, Mayor Walsh, we really want to have input on all these large developments for accessibility. So the checklist doesn't call for any new regulations, but it kind of summarizes all the accessibility into one document. And my architectural access staff, Sarah and Patricia, they work with the developers on pretty much every big project. Everyone's required to do the checklist. So it's been a tool that we've been using for at least 5 years, but it was recently codified into the zoning board, not the zoning board, the zoning bylaws. I'm not sure what the official term is, but now that it's codified, it is actually a requirement, the zoning code. Right. That's it. So now that it's part of
Well, yeah, and the interesting thing, and so then I'll talk about the OFE stuff, but the interesting thing is that they also codified and added a whole section around fair housing. And I think it's great, right? But I think that the challenge is always, because it's only for a large project, what about the ones that are smaller? And why are they off the hook? I never quite understand that. I mean, I know I'm a lawyer and I get that it's the way that the law works, but it feels like all of them should be required to have real accessibility, not just the large projects.
It's interesting that you say that, because that's exactly what my office pushes for.
Of course, right?
Well, our Director of Architectural Access, Patricia Mendez, has actually worked very closely with the National LEED organization. LEED is green development, and she's actually worked to get a pilot lead credit for accessibility, which encourages accessibility. And we've institutionalized a lot of processes so that they'll be codified well beyond our staff jobs at the commission. So we have Sarah, who sits on the Public Improvement Commission. She gets to vote on all the sidewalk accessibility. That's also a new appointment. And we work on all developments, small and large, to really increase accessibility.
So that's great. So thank you for that answer. And then I'll just give people a quick update. So hi, everybody. My name is Mimi Turchnetz. I'm with the Mayor's Office of Financial Empowerment, which is a small little office that works to create access and opportunity for all folk in the city of Boston, specifically around financial empowerment items like accessing credit building and inclusionary banking and financial services. We do credit building. We really work on trying to make sure that through policy and strategy and programs and practices, people have access to activities and programs that really provide things that eliminate disparities in the economy, right? So it's kind of policy stuff and really drilling down in terms of programs. I mean, one of the things that we've been doing over time with the office, with the commissioner's office, is working on, originally we had a disability working group, which was allowed folk in the disability community to get involved in providing insight and vision into the way that we provided free tax preparation, because our office does free tax preparation and does that for 13,000 people annually. And so we're going to be re-engaging the disability work group, and we would invite everybody on this call to participate in that. I have a disability ambassador, and that person is going to be coming to these meetings and getting to know everybody and really helping you navigate free tax preparation and credit building. We've been having over the past couple of years ASL tax days in partnership with Deaf Inc. And when COVID hit and things shut down last year in March, we had to shut down our ASL tax days, and we weren't really able to get them back up and going again. Believe it or not, Jess, I got a call or an email from Jill Hatcher from Deaf Inc. just today, asking about whether or not we were going to do the ASL tax days. And I asked her, well, are we going to do them, and can we do them at Deaf Inc.? And I think the answer is probably no, not at Deaf Inc. But maybe Wesley would be interested in having a conversation around this. How is it that we can serve the ASL community through our tax days across the city? We're doing virtual tax preparation. We're doing drop-off tax preparation. Some of the tax sites we have, we've had over time, up and down anywhere between 12 tax sites to 35 tax sites. This year, a bunch of the tax sites are going to be fully virtual. Some there's going to be drop-off, so people can in fact drop off their tax returns, and then the tax sites will do those returns and people can come back and sign for them. So there's a whole host of different things going on this year. And part of what we want to make sure is that folk in the disability community, all of you, have access to free tax preparation, to credit building, and to all of these services around financial empowerment and inclusionary banking, so that you don't get ripped off by paid preparers, so that you don't have to wonder whether or not a tax preparer is doing right by you. I think a really interesting piece of information is that the volunteer income tax assistance, IRS trained volunteers are way, way, way more trained and make way less mistakes than paid preparers. Who would have known that, right? So believe it or not, pre-tax preparation through the Volunteer Income Tax Assistance and the Boston Tax Law Coalition is safer and is a better service than if you go to H&R Block. So that's just a teaser. Jessica, although she's leaving, can find me. Commissioner obviously can as well. I welcome all of you to participate in our work, and we want to work with you and make sure that the community gets access to these resources and services. So thank you. And if anybody has any questions, I'm happy to take them.
Hi, Mimi. It's Jerry.
Hi, Jerry.
Hi. Good to see you again. Are your sites? Do you have a list of your sites on your website, or can you get that to us that are doing them? And
we can. We are in the process of trying to finalize the flyer because we're just kind of, all of the details are not completely worked out yet. And there's also this thing, I don't know if people, it's interesting that Caitlin didn't talk about this in the current Stimulus 2, but there's some language in the Stimulus 2 in the package that was just passed that people got the $600 out of, that's doing something called look back, which is a little complicated. It's about being able to use either this year's dollar figure or last year's to make sure that you get the maximum amount of earned income credit. It's a complicated thing, but that's a little complicated. So we're trying to make sure that that's on the flyer so that people know to ask about that. We can talk a little bit more about that later on. But the short answer is yes, of course. The minute that they're done, I'll get them to Commissioner.
That's awesome. Thank you so much. And Wesley did have a question or a comment.
Yes, thank you so much, Mimi. I see that you already mentioned my name and the ASL tax days, and I do just want to let you know that I'm actually a board member for Deaf Inc. So I would be happy to follow up with you, maybe offline. You can also contact me as well. Jessica has my email address, so she can give that to you. And we could talk from there and see what we can figure out. Maybe a solution for these ASL tax days this year. I think it's great to advocate for that because obviously coronavirus, people have changed everything to virtual anyway. So we could talk about that and some different options for finding a solution. I don't have any questions now. I just had that comment that we can follow up offline after this meeting to see what we can come up with.
Yeah, I would say definitely, Wesley. I think that makes perfect sense. It's uncharted territory. We had started to get really good at the ASL tax days, and Jessica was a huge part of that success. But with them really challenged, just in terms of not really being at the location and such, we may have to figure out a new methodology for this year. So let's do that. Let's follow up. Jess can connect us, and we can figure out what to do, even if it's trying to do some stuff with Zoom and having an interpreter participate. That may be one of the things. So let's talk about it. That'd be great. I'll follow up. Okay.
Great.
Yes. Great. Thank you.
And I just had one more comment to wrap up my report. I know that Carl is on the line in the meeting, and I didn't know if you wanted to talk about your appointment, Carl?
Yeah, hi, this is Carl. I've been reappointed to serve on the Federal Communications Commission Disability Advisory Committee on behalf of the city of Boston. And that's good because on that committee are a lot of people that serve the deaf community for relay services and the deaf blind distribution equipment program nationally. People that work in television such as Comcast, Apple, CBS, NBC Universal, they're on that board. So in terms of how to make media accessible through closed caption, audio description. So, and we're going to have very shortly a new commissioner with the change of administration. And without getting too political, that should open up the number of topics that we will explore where we didn't necessarily explore previously. So I'm very excited about this coming term. Thank you.
Yeah,
I know
congratulations,
Paul
Bill.
has a question or comment.
Yes,
Just want to say congratulations to Carl.
thank you, Paul.
Anything else, Commissioner?
Nope.
Any other announcements? I know there were other announcements or upcoming events. Did you cover it all?
Yep, that's all I had.
Okay. Let's see. Do we have any old business?
I do.
Go ahead, Elizabeth.
Yes, Commissioner, what is the status for the City Plaza renovation? Our request for something in writing for the proposal, and now that Mayor Walsh will be leaving, does that affect his staff at that level with Chief Brophy, or I just don't know what the inner workings are or the current status?
Yes, I did mention it earlier. You may have stepped away, but just to say, that's fine, that there will be transition in staff, obviously. We don't know who yet. We do know most likely it will be Mayor Walsh will be going to Washington, which we congratulate him, and we're really so glad to have a friend in Washington and an ally, a strong ally. But as far as the agreement, we will definitely still work on that. The only thing I can say is it may possibly be delayed, but it's something that I can prioritize to move through, so that it doesn't get lost during our work on transition.
Okay, thanks.
Great. Anyone else on the board have any old business they'd like to discuss? Hearing none, do we have any new business?
I just want to note that the Governor's State of the State is next week on the 26th, and they will be ASL interpreted for those who are deaf, and he'll just be talking about the state of the Commonwealth. And I also wanted to congratulate the accessibility for the mayor's State of the City address last week, where they had the interpreter picture-in-picture. That was well done.
I do, yeah.
Great, and I will add that I thought his remarks were quite appropriate, and obviously he loves the city of Boston. He got choked up a couple of times. He did mention disability right towards the beginning of his remarks, so that's one check mark. I challenged him one year when he did not specifically mention disability. That I said next year I want to make sure you get it in, and he's done that since I challenged him to do that. So thank you to the commissioner and her staff for keeping that on the mayor's staff's radar, and for all the good work that you guys and advocacy work you do on our behalf. And I just wanted to add too, I know Jessica mentioned it, at the beginning of the meeting. This is her last week and helping run this meeting, and I cannot thank her enough. So I want to thank you on behalf of the advisory board and the entire disability commission, the disability community in the city of Boston. You do immeasurable work, probably thankless work. So I just wanted to take a minute and thank you for all that work. And I know you're going to continue that work in your new role, and I'm very excited for you, but very, very sad that we have to lose you as well. So thank you for all you do, Jessica, really.
And I'm going to put Jessica on the spot. We have a small gift for her, and I'd like you to open the white envelope because we couldn't have all the staff pass around a card to sign, so we did an e-card where we all got to sign it online. So that's the sign of the times that we're in, but we will all miss Jessica. We will miss her terribly. We'll never replace her, but the work will continue, and we will stay in touch. Even though I don't do much social media, I have Jessica's phone number, so I will be texting her. And we wish her all the best, and we know that she'll thrive in her new role.
Can we ask Jessica where she's going and what she's doing?
Yes, mostly because I guess I've left this job, so as of Friday. But as of Monday, February 8th, I will be the manager of accessibility at the MFA. So
Oh, you're taking over Hannah's job.
I am. So I will still, my dedication to the disability community still stands, and I'm hoping that when it's safe that you all come. Olivia's already told me she's going to come and she's going to show me all the ways that the museum is inaccessible, and I'm thrilled for that. And so I'm not going to read the card that Kristen showed me because I looked at it and I'll probably cry. So I don't really want to cry on a live broadcast. Maybe on a Zoom call tomorrow, but not on local cable access. But I just want to say that I really appreciate. It's been a complete joy to work with all of you. And we will continue to do the work, even if I am not in this role or here on this meeting. So thank you, everyone.
Congrats, Jessica.
Congratulations.
Does she live in the city of Boston? Can she join the board?
I still live in the city of Boston. I'll still be a Jamaica Plain resident.
Yeah, so Kyle mentioned you could join the board.
Yep, we still have 2 open seats. I'm going to be reposting it again this week.
I appreciate everyone's support and encouragement of my participation.
Well, if she joins the board, we'll make her the secretary, so she still has to do all the writing.
Nope, I quit. I'm not coming in tomorrow. I'm done. Thank you, everyone. This is very sweet.
Thank you. We can't thank you enough again, Jessica. And with that, do I hear a motion to adjourn?
You know I'm going to do this, right? I make a motion to adjourn.
My last time,
I
Carl.
second.
All in favor?
Aye. Aye.
All right. Pass that survey information or focus group information along to your groups. Sign up if you're available next week to participate, and we'll talk to everybody soon. Take care. Keep safe. Be well.
Good night, everybody.
Thanks,
Take care. Be
Thank you,
safe.
everybody.
Bye.
Bye-bye.
I'll also
Bye,
stay.
Jessica.
Bye, Jerry. Yeah.